More than half of the people in the United States get their health insurance coverage from their employer, and most of them aren't happy with that coverage. A new study came out that helps explain why your coverage from your employer is so awful. And I have Farron Cousins from Trial Lawyer Magazine with me now to tell us about it. Farron, this story, it's still under the radar. ProPublica did a story on it. NPR did an investigation on it. And right now, people are complaining that this new shift, the new Obamacare shift, the new coverage issues, they feel like they're getting a lot less, and they're blaming it on the legislation to some degree. But really, when you look at this story, it's really about the same old thing. The people at the top trying to squeeze as much money as they can out of the American consumer.
And what they do, what this investigation's found, is that a lot of companies out there, their HR departments hire these insurance brokers. They're not with the health insurance company. They're not with the company buying the insurance. It's essentially this group of middlemen. And what they do is they work with the health insurance company and say, all right, you let us know what plans you have. We'll go sell them to the employer. But what we didn't know until now is that the insurance companies and these brokers had worked out deals. These brokers, in many cases, get a percentage of the plans they sell, and they get that as long as the employer goes with them.
Let's back up. First of all, we would expect we expect that salespeople get commissions.
Right.
We expect all that. This is different, though.
It is.
This is where you go to the HR department or whoever it is that's making the decision. You say, look, we have two options for you, option A and option B. And they don't tell them about option C, because option C might give the best coverage. It might do away with a lot of the problems that A and B have. But the broker, who really has a conflict of interest here,
yes,
clear conflict of interest, says, you know what, we think you ought to go with program A, because program A, the broker is making a lot of money that he's not disclosing. Why he doesn't talk about C, he talks about A, because that's where he makes the most money. That's where he gets his trips around the world, his voyages to Europe. This is something that there's no regulation here. Right. We have brokers that are out there operating, and people working in companies don't even know why their insurance coverage has gone from bad to worse.
Well, and it's interesting, too, that you brought up, these incentives they get. Not just the commission. You understand if somebody sells and they get a commission, whatever. But they're also offering these bonuses. Sometimes for a group of brokers, you can get a $150,000 bonus. But it's not the health insurance company that's paying that. Those bonuses, these trips, they had one offer, go play baseball with a Major League Hall of Famer. That's actually built into the price of those insurance plans. So the employer and the employees who buy the plans, they're the ones paying for the bonuses. It's not coming out of the health insurance company's pocket, not coming out of the broker's pocket. We, the people who have that insurance, paid that as an addition to a premium.
The problem is so bad in the United States that they've actually had to there are actually organizations that have been put together where they're saying it's called Health Rosetta.
Yeah.
Health Rosetta is an organization that says, look, there are about 100,000 brokers in the country. And all those 100,000 brokers should be required to disclose to the HR or to the company, we have these other plans and they're better for your employees, but I don't make as much money. So this organization, Health Rosetta, is saying, the numbers are staggering. I think there's only 100, maybe 110, 111 organizations that follow this Rosetta plan, and that's out of 100,000 brokers in the country. Why? Because there simply is no transparency. There's no regulation to demand transparency. And because of that, the problem for the average person, the employee, is the coverage is getting much less, and the cost just to have the coverage is increasing.
Right. And this Rosetta group, what they do is, they've said, listen, we don't take percentages, we don't take commissions. It's a flat fee. We do our job for you. We're going to do the best we can for you. Nobody is giving us additional money, and that's what makes the difference. And with these plans that we currently have now, the upsells, what they'll do in a lot of cases too is charge for a more expensive plan that covers things that there's no way anybody in your company could ever possibly need.
Okay,
but they sell it as, well, just in case, what if you have an employee and this happens, then your whole plan gets blown up. So buy this one with this extra coverage.
So here's what we tell people. Here's what's important. We know Health Net of California is doing this. We know Emblem Health in New York is doing this. We know that Blue Cross Blue Shield is doing this. The Blues are doing this. If you have a human source HR department, I think the thing to do is to go to them and say, look, is this taking place? Because the HR department, most of them don't even understand how this works.
Right.
They have training in HR, but they don't have training to understand this scam. In the scam, look, it's impossible for me to believe that if you tell a broker, if you sell this item that is substandard by all means, it's substandards. If you sell this, we're going to give you can make as much as $150,000. These bonuses run up to where the entity is paying out $150,000 in kind of extra bonuses for selling this kind of stuff. And so it's impossible for me to believe, Farron, that in that environment that you don't have brokers that are taking advantage of this, and the HR department really doesn't even know about it.